Greetings, everyone. Thank you for being with us today. It's been a sad couple of weeks for us with the passing of Dr. Paul Farmer, as you are aware, but we are trying to keep his memory and his legacy alive through our work on health equity and justice. And we would like to thank everyone who's been really supportive, sending us their sympathies and messages. So thank you, everyone. Let me start by introducing myself. My name is Jon Johannes, and I'm the chair for the Center for Gender Equity at University of Global Health Equity. And in my current role as the chair for the Center for Gender Equity, I'm responsible for heading the academic research and community development projects pertaining to gender equity, together with my team. And let me say something about this. So as you can see in the slides, the center operates on 4 major pillars, and it has been operational since 2020. We've been trying to contribute to the gender equity and diversity through education, research, organizational development, and community engagement activities. And let me say a bit about this. In our academic role, as you can see, we have tried to mainstream gender in our School of Medicine programs. So we have an introduction to gender and social justice in this under the Bachelor of Medicine, Bachelor of Surgery program. In our Masters in Global Health Delivery program, we have recently launched a new track on gender, sexual and reproductive health. And we have our first cohort of students from 9 countries. We have 18 students right now, and it's been a really interesting process. We want to make sure that this gap in equity in access would be addressed through these kinds of programs, and we plan to do a lot more in our academic activities. Well, in under research activities, of course, the center works alone and also in cooperation with different departments across UGHA and externally. It's a young center, but we have started a study on barriers to females' access to Bachelor of Medicine, Bachelor of Surgery programs in Rwanda, after noting that there is a gap in the number of females and male physicians in Rwanda. So this study is ongoing. It's been a really interesting process. We've been going through different schools in a couple of districts, provinces, I mean, and we will have the results of this study out soon. The other activity we're engaged is student and community engagement, and under this we have an important program, a mentorship program and support. And we have right now 54 mentees who are matched with amazing mentors across the globe. And we want to make sure that the majority of our mentees who are females, as you expect, will gain experience and skills through this engagement. So yeah, we've been doing quite a lot in the past 2 years. We have plans to do a lot more. We want to make sure that girls and women are represented in these fields where they have limited engagement and leadership. So that is one of our goals. So I have said quite a lot about the Center for Gender Equity, and now without further ado, let me introduce and welcome our great panel of speakers. Okay, so let me start with introducing Professor Agnes Binagwaho, who is the chair of this panel. Professor Binagwaho currently resides in Rwanda and is the Vice Chancellor and co-founder of the University of Global Health Equity. She previously worked as the Executive Secretary of Rwanda's National AIDS Control Commission, as Permanent Secretary of the Ministry of Health, and as the Minister of Health. is a senior lecturer at Harvard Medical School and adjunct clinical professor at Dartmouth Giesel School of Medicine. She is a member of multiple editorial, advisory, and directors boards, including the think tank, the Think 20, T20, and the Rockefeller Foundation, the African Europe Foundation, and the Commission on African COVID-19 Response. Professor Agnes is a member of the US National Academy of Medicine and the World Academy of Sciences, and a fellow of the African Academy of Sciences. She has also been named among the 100 most influential African women for 2020 and 2021. It's really a pleasure to have to be part of Professor Agnes's webinar, and I would like to welcome her to chair this webinar. But before doing so, let me introduce the speakers. And next, I will introduce Professor Flavia Senkubuge, who's a medical doctor and a public health medicine specialist. She is the Deputy Dean Stakeholders at the Faculty of Health Sciences at the University of Pretoria, South Africa. She is also the President of the College of Medicine, South Africa, SAMESE. And the SAMESE is the apex body of medicine in South Africa. She is the current chair of the WHO Afro-Region African Advisory Council on Research and Development, and is the president of Women in Global Health, South Africa. She is also the vice president of the African Federation of Public Health Association. Welcome, Professor Flavia. The other panelist on this webinar is Renzo Quinto, Dr. Renzo Quinto, who is the Chief Planetary Health Scientist of the Sunway Center for Planetary Health in Malaysia. Concurrently, he is the Associate Professor of the Practice of Global Public Health and Inaugural Director of the Planetary and Global Health Program of the St. Luke's Medical College of Medicine in the Philippines. An Obama Foundation Asia Pacific leader and Aspen Institute New Voices Fellow. Renzo is a member of several high-level groups, including Philippine Climate Change Commission, Lancet Chatham House Commission on Improving Population Health Post-COVID-19, Lancet One Health Commission, and Advisory Council of Global Health 50/50. He has served as a consultant for various organizations, including WHO, World Bank, and USAID, among others. It's a great pleasure to have you on this panel, Dr. Renzo. And welcome. And finally, I would like to introduce Professor Marlene Timmerman, who is a well-recognized global leader in women, adolescent, and child health and rights. She brings academic, technical, political, governance, management, and leadership skills to the table, as well as diplomacy, advocacy, fundraising, and clinical expertise. She has a strong track record of working with governments, multilateral organizations, academia, professional bodies, development agencies, private sector, and a range of organizations. At present, she holds the positions of Chair of Department of Obstetrics and Gynecology and Director of the Center of Excellence in Women and Child Health at Aga Khan University. Previously, she served as the Director of the Department of Reproductive Health and Research at the World Health Organization. In Geneva, she was elected senator in the Belgian parliament from 2007 to 2012, where she served as a member of the Commission on Social Affairs and chair of the Commission on Foreign Affairs and Defense. In that capacity, she was also a member of the European Parliamentary Forum and chair of the HIV/AIDS Advisory Group of the Interparliamentary Union. It's such a pleasure to have you all in this panel. It's an honor and a privilege. And now I would like to give the floor to Professor Agnes so that she can take us through the webinar. Thank you.
Thank you, Sion, for the warm welcome and for hosting this webinar from the Center for Gender Equity, which has enabled our university to continuously achieve our mission of ensuring that gender equity in healthcare and health research begins with equity in health education classrooms. This approach is needed to radically change the way healthcare is delivered around the world by training generation of global health professionals who strive to deliver more equitable quality health services for all. Greeting to everyone from around the world. For some of you, it is very late. For others, it's very early in the day. Today, exceptionally, I share this webinar out of Rwanda. I'm in the US, where I came to participate in the memorial service for our dear friend and co-founder of the University of Global Health Equity, Dr. Paul Farmer, who passed away last month, and to pay tribute to a giant leader who shaped the future of global health and left a legacy that will impact far beyond global health and the place where he has worked. The best way to honor Paul's memory will be for all of us to stand stronger together, doing what he loved most, which is fighting poverty and disease, promoting human dignity with a focus on the most vulnerable, and promoting equity. And I thank Flavia, Marlene, and Renzo to have joined today Ask Professor Agnes Equity webinar hosted by Sion. And this webinar is totally aligned to what Paul have fight for all his life. It gives me a great pleasure to welcome you all to this webinar. You, our estimated attendees, expert panelists, and global health enthusiasts. This monthly equity webinar is a platform created to discuss global health threats and challenges and serve as a vehicle for change through insightful discussion on the experience and recommendation of global health experts working on the ground to respond to these threats. This monthly Ask Professor Agnes webinar Equity is a platform created like all the one we have done previously and we will do in the future to commemorate a UN International Day related to equity. And this month, we want to raise awareness on the International Day of Women and Girls in Science that was celebrated in February. And we didn't celebrate because of the passing of our friend, Paul Farmer. So in relation to this, our topic of discussion will be improving the challenges faced by women and girls in science during COVID-19. A symbolic day, the day of we celebrate globally Women's Day to discuss such a subject. Before starting, I have some logistical information to share with you. To ensure access for people who are hard of hearing, please access the closed captioning function on the bottom of our Zoom screen. You can access this by clicking on the closed captioning CC button to benefit from real-time text translation. For persons with visual impairment, our panelists have been prompted to be more descriptive and of any image in the slide. Lastly, feel free to submit your question in the chat box for the live Q&A anytime during this webinar. All questions that will not be answered during the time of the webinar will be answered through social media with the hashtag #AskProfessorAgnes. In today's webinar, we are celebrating the International Day of Women and Girls in Science, which was first proclaimed at the initiative of the UN in 2015, with the key objective of progressing the significant role of women and girls in the development of all science. This initiative was also part of a larger long-term effort toward closing gender gap around the world by promoting equality as outlined in the 2030 Sustainable Development Goal. Even though more women are pursuing careers in science, technology, engineering, and mathematics, gender gap and harmful bias in this field of science still persist today. The present gender gap in science and technology still holds women back. According to UNESCO, in the science report, only 33% of researchers are women, even though they represent 45% and 55% of students at the bachelor's and market level of study, respectively. And 44% of those enrolled in PhD program, especially in the health sector. 70% of health and social care workers are women, and yet they are paid 11% less than their male counterparts globally. Regardless of the promises of equality and inclusivity, the progress made by this agenda has been fragile and slow, and has even significantly undermined by COVID-19 pandemic. COVID-19 pandemic has exacerbated the gender gap. Women have been at the front of the fight against COVID-19, contributing through groundbreaking research into public health vaccine discovery, treatment, and innovative technology, and healthcare workers and essential workers. But we see that women remain behind, even after putting the same amount of effort than men, and even more than men. Studies have proven that when women are integrated in research teams, the collective production of the team improves. And I hope we can all agree that diversity and inclusion are key factors in the advancement of science and innovation. It is therefore important for all of us to promote and advocate for more girls in science, because everything is in the pipeline, but not only. Because when the girls and the women do all the journey, their advancement and promotion is less frequent than men. However, during the global fight against COVID, we noticed also that women had more difficulties to remain productive in academia and in research and in science. Their productivity and scientific output in those fields were more affected than for men, leaving the loss of women's scientific expertise from the public when the world needed it the most. For example, female scientists in Europe and USA reported a 5% larger decline in research time compared to their male colleagues during the pandemic, given that they were the primary caregivers of young children, and this is a research of UNESCO. With the current COVID-19 pandemic, where millions of people were obliged to work from home for the past 2 years, and the issue of academic gender disparity has become more evident, especially for women with young children. When many schools across the world closed, women had to spend more time fulfilling domestic responsibilities such as cleaning, cooking, engaging in children care, and homeschooling, which now took away time for their scientific work, and this far more compared to their male counterparts. For example, among time women spend on household work, it increased from 52% before the pandemic to 58% during the pandemic. And the time spent providing child care increased from 51% to 66%. This shows how there is a need for cultural awakening for men to help remove bias such that both men and women can share domestic responsibilities equally, so that women can have equal time and chance for their scientific careers as have their male counterpart. Cultural issues such as bias and stereotypes, along with often male-dominated working environments that are characterized by strong hierarchical nature, appear to be major challenges that face young women that graduate in science. In Africa, more than 120 million girls have been affected by school closure as a result of COVID-19 prevention measure. This affects especially girls who live in poor and vulnerable households and who may have to drop out of school. And many countries introduce e-learning, but in most cases, it is only accessible to few students in our continent. For example, for classes that were on television in Ethiopia, only 2% of families living in rural area had access to TV. This limits vulnerable and poor to continue their education. Moreover, looking at data from gender perspective, globally, men are 21% more likely to have access to internet than women. And in sub-Saharan Africa, boys are 1.5 times more likely to use a cell phone than girls. Yet, most of those courses during COVID-19 lockdown were delivered through this channel, which make this imbalance a demotivating factor for young girls who may be interested by science. In today's webinar, I hope we come with recommendations on how we can create a world with gender equity in science and in reducing the pay gap, for example, and also have women in more decision-making position in science field. We need policies that mandate equal pay for the same knowledge and experience and same work between men and women. To recognize the contribution of women in science, we need to fight the bias and the cultural ground of all this. Government and institutions need to also create work-life balance culture at work that allow women and girls to be engaged in their professional life, but also be available for research, writing, and more studies, and also fund and support their research work. So let's discuss all those challenges and listen to our esteemed panelists. But before we dive into the discussion, let me begin by asking each of our esteemed panelists to give their introductory remark. Join me first to welcome Flavia, who will be sharing with us today about the challenges faced by women and girls in science in Africa. Flavia, the word is yours.
I really want to say good afternoon, everybody, and it's a great honor for me to receive this invitation from the University of Global Health Equity. And it's even more of an honor for me to be talking about the challenges faced by women and girls in health science in Africa during the COVID-19 pandemic. The current situation of women in science in Africa is that indeed we have persisting gender inequality, which severely limits women from achieving their potential and effectively contributing to the development agenda. And this particular statement was made in African Women in Science in 2015. We know that globally, research and development employs only approximately 28% of women, and the number is less so in the Africa region. Not only that, women are employed in the lower echelons in research and development with really limited leadership opportunities and decision-making. And women scientists largely work in academia and in government, while men are sometimes found in the private sector, where we know that the private sector has better pay and opportunities. There are numerous policies indeed in Africa that are aimed at including women in science, but these particular policies are rarely implemented. And we do know that in our region, we have a lack of gender-friendly policy frameworks. These would include, for instance, childcare, post-pregnancy care, career re-entry, and the lack of the gender-friendly policy framework chase women away from sciences. There are a number of challenges which are faced by women and girls in healthcare science in Africa during the COVID-19 pandemic. Certainly the pandemic resulted in a crisis that was already there, that worsened an already existing crisis of structural inequalities. And healthcare workers, certainly majority of them who were on the front lines were women, with a higher risk of infection, increased psychological stress, negative effect on their mental health. And certainly many women did experience conflict between their work and family schedule during this time of COVID-19, where increased demands and work were made on women. And the lockdowns resulted in added responsibilities, certainly disproportionately so at home on women. And there was certainly a conflict between workplace expectations and the social cultural norms. There are a number of scenarios in terms of the best and worst case challenges faced by women in Africa pre and post pandemic. And certainly I must say categorically that the challenges faced before and after the pandemic actually haven't changed and they have worsened. For instance, if you look at the disparities related to healthcare in areas such as the sexual and reproductive health, housing inequalities, limited access to facilities and infrastructure, lack of access to education, increased domestic abuse, not just only in the Africa region, but certainly globally as well, household inequalities, structural inequalities, which generally favored men, and COVID-19 certainly resulted in increased unemployment among women. And indeed, the prevailing situation is as follows, that evidence indicates that women in sub-Saharan Africa live on the fringes of the peripheral sectors in the African economy. There are a number of solutions which I would like to propose. For instance, more policies to encourage women to join health sciences. And these policies should not just be at the distal end. They really need to start at primary school level. And the actual implementation of these policies and programs, and not only just to draft these particular policies, but really to make sure that they are implemented. And there is a need for a change in the system, a systemic structural change that will cater to the unique circumstances that women face, for instance, post-pregnancy and child care at work. And also there is a need to include women in the decision-making process, and we need women to really lead, not only to have titles where they say so-and-so is the leader of this organization, but there will be somebody who is shadowing her leadership. But certainly we need women who truly lead and who truly make the decisions. And lastly, I want to say that we need more initiatives, such as the UN Economic and Social Council's resolution of 2011-17, which supports the role of women and girls in science through education and training. I thank you.
Thank you, Professor Flavia, for an insightful presentation. Now, I would like to welcome our second panelist, Dr. Ramon Lorenzo, better known as Renzo, who will be sharing with us the challenges women in Asia have faced, but also how they can be overcome. To you, Renzo.
Hello. Thank you very much for this wonderful opportunity that you've given me to be part of this very important conversation. I was tasked to provide some situationer when it comes to the status of women and girls in health science here in Asia, but also because I'm the sole male member of this panel, and of course I'm deeply humbled by this invitation. Perhaps I will also give some insights on the role of men in terms of how we can achieve gender equity in science, in medicine, and in health. So this is coming from a very interesting website. When I Googled Asian women in science, I saw this website. It has the faces of some of the amazing female scientists of the region. And there's no doubt that women in Asia have contributed a lot to the advancement of global science, and in particular health science. But this is the situation in our region. As you probably know, I come from the Philippines, and the Philippines is the only Asian country that ranks in the top 10 globally for closing the STEM gender gap. The Philippines always is ranked very highly when it comes to gender indices. For instance, the ones developed or released annually by the World Economic Forum. And the same situation can be said of its, in terms of the role of women in STEM, in science. However, if you go to the neighboring countries, the situation is not as promising. While women comprise 52% of science and technology researchers in the Philippines, only 1/3 of researchers in neighboring Indonesia and Singapore are women. And if you go northwards, upwards, if you look at Japan and Korea, the situation is way more severe. These countries have high levels of technological sophistication, but only 15 and 18% of researchers are women, respectively, in those countries. So what are the barriers and challenges to meaningful and genuine inclusion of women and girls in Asian science? So first, there are certainly prevailing stereotypes about the role of women in this region. It's rooted deeply in some Asian cultures that tend to be very patriarchal. And we see that not only in science, but in many different aspects of life, of society. There's also a very limited presence of women leaders in academic institutions and scientific councils. Hence, there are also fewer voices advocating for women scientists' concerns around these decision-making tables. Luckily, in the Philippines, for example, we already had several ministers of health who are women, but that is not yet the case in many of the Asian countries. Also, there are multiple role expectations and pressures that are being borne by women scientists and professionals in the health sector. This is not unique to Asia. For sure, this is also experienced in many different regions. And we've seen this problem being worsened or reinforced during the time of COVID-19 with the work at home arrangements and mobility restrictions that are accompanying the pandemic response. And therefore, that really limits the productivity, especially academic productivity, of women who are also mothers, who are also sisters, who play other important roles, for instance, in the household and in other arenas. And of course, there's also limited visibility of women scientists in Asian academia and industry in general. And we know that if we want young girls to become inspired to become women scientists and leaders themselves, they need to see people who look like them, who sound like them, who act like them. And therefore, we need to increase the visibility of women scientists here in the region as well. So this is an interesting diagram that came from a report published by the Australian government, which is part of the broader Asia Pacific. And I will not belabor you with the details, but you can see that throughout the journey of a scientist, especially a woman scientist, there are so many different pressures and obstacles that are being encountered along the way. And these are obstacles that need to be addressed if we truly want true and sustained advancement of women and girls in science, especially in this region. So what are the solutions? And for sure, these solutions are not unique to the Asian context. But also, I think, as I mentioned a while ago, as the only male member of this panel, perhaps some of the solutions here are also about how can we truly engage men, male scientists, to be part of achieving gender equity in science and medicine and in health. So of course, we cannot just be doing tick box exercise or adopting checklists to improve gender inclusion in science, in academic institutions. What we need are gender transformative environments that truly dismantle stereotypes and patriarchal structures, such as the ones that I mentioned a while ago. Of course, we need gender equal educational systems, and that begins from early childhood. And unfortunately, here in Asia, a lot of young girls are still not being sent to school because, again, of the earlier comment that I gave about, these stereotypes about the role of women. Also, we need to invest in women's career and leadership development. And perhaps part of it is intentional recruitment, because we know that unfortunately, women and girls, especially in science, still remain invisible. And we need to be very proactive in bringing them to enabling environments and opportunities. Women and men leaders in science, including myself, should be mentoring the next generation of girls and even boys who acknowledge that science will never advance if it only involves one half of the population and neglects the other. And of course, we need more male scientists, such as myself, to not just create or share, but also sometimes give up space for women and girls in order for science and medicine and global health to become much more inclusive. So I would like to end my presentation by giving tribute to my women researchers in the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine. I strongly believe that the future of Asian science, medicine, and global health is female. And that's why I, as a male scientist and ally in this fight for gender equity, I am truly committed to creating spaces and opportunities so that everyone, male or female, girls or boys, will have equal opportunity in science and in health in the years to come. Thank you very much.
Thank you very much for your remark and your recommendation on how we can understand and also give visibility to women in science. And if you have been chosen, it's because you are representing really the spirit of feminism that we need to advance this agenda. Allow me now to welcome our third panelist, Marlene, who will be presenting on the global perspective of this challenge and how we can improve and overcome this challenge. Marlene, the floor is yours.
A very good day, Prof. Agnes, dear colleagues and friends. It's really an honor and a pleasure for me to contribute to this session, this very important session today. A short biography: I'm a medical doctor, obstetrician, gynecologist, public health, spent most of my life in academia, and had 2 terms in politics as elected senator in the Belgian parliament. I went to Geneva, where I was the WHO Director for Reproductive Health and Research, before I came back to Kenya to work with Aga Khan University, where I'm also the chair of an AKU UNESCO chair in youth leadership, science in health, gender, and education. Now, the topic, April 2020, COVID pandemic. Many countries instituted national school closures, putting more than 1.5 billion students at risk of falling behind in their education. And even more so, women and girls who face additional threats such as sexual and gender-based violence, unintended pregnancies, forced marriage, and early transitions to work. Estimates are that 20 million girls will not return to school after COVID due to these and other factors. Distance learning through digital technology has kind of raced in many countries to replace the traditional school system. And globally, 2.2 billion children and young people aged 25 and less do not have internet at home. So this is a kind of a bottleneck for them to adhere to distance learning. And the differences in access to internet are stark between rich and poor countries, but they also give us an opportunity to change that and to close this digital divide. So the problems are, there is indeed a risk of deepening the social, economic and health inequities, particularly in in low-income countries. The divides are there. Just think about, we are not talking about this, but vaccine coverage. It's really an inequity that in our part of the world, so many women, so many people don't have access to the vaccine. Now, COVID-19 exacerbated the gender and digital divide. As I said, disruption of continuous education, an exacerbation of vulnerable groups, a digital divide, as we addressed already, and elimination of chances of the current generation of students to participate in our modern economy. Current global efforts are made, we know that. They include advocating for policies for educational inclusion, leveraging on digital technologies. Ministries of education all over the world have deployed different remote learning policies, and education services moved from physical to online service provision. And education stakeholders have been inspired to reimagine education by harnessing technology. And I refer to really a wonderful document that you should read and that has been quoted by our guest, Prof. Agnes. Opportunities, next steps, and future outlooks. Investment in public education needs to be protected and incentivized so that schools everywhere can be physically ready for physical training, but also digital, with expansion of internet in the schools, in the homes, in the communities. We have to foster responsible leadership and governance, clearly defining global educational priorities, sustainable funding for the development of our educational systems in low-income countries, and implement policies oriented to equity, and inclusive education to guarantee and strengthen the right to education in the context of achieving the UN Sustainable Development Goals. We need to address education, economic, social, and health needs, and every cloud has a silver lining, also COVID pandemic. So we have to grab this opportunity and close this divide, this digital divide and many other divided device. And here we have a source for all of you that, of course, the slides will be shared, that you can consult. Thank you very much, and happy to take questions.
Thank you, Marlene, for this important overview and for your insight on the global image of the challenge that faced women in science during COVID, and also for the solution that you are proposing, a very good ground for discussion with what have brought Renzo and Flavia. So thank you to all our panelists for great presentation. I remind our audience to send your question through the chat, and because now we are going to dive into the Q&A session, and I have already great question. For all the question, I want to recall that for all the question that will not be answered and will be in the chat at the end of the webinar, we will answer them using hashtag Ask Professor Agnes on Twitter, Instagram, and Facebook. So do not hesitate. We wait for your question. My first question will go to you, our host, Sion. Tell me, as the chair of the Center of Gender Equity at UJG, what kind of other program and future plan do you have to address these challenges in women participation in science, technology, mathematics, especially in the field of STEM in medicine?
Thank you, Prof. Agnes. We do intentional enrollment of higher percentage of females. As you all know, more than 65% of our students, our medical school students, are females. We do not discriminate against males, but given that we have the national numbers show the gaps, the higher representation of males in the field of medicine. As physicians, we want to close that gap. We also want to understand the reason behind this gap. Therefore, as I mentioned at the beginning, we are now doing a study on barriers to females' access to Bachelor of Medicine, Bachelor of Surgery programs in Rwanda by taking to provinces in the country. And when examining these gaps, we also want to make sure that we examine different layers of systems affecting these girls. Is it only gender? Does age, socioeconomic background, religion, and so on come into the question? So it is very important to assume that everyone doesn't have the same problems and challenges, and we do that through our research projects. And another thing we did last year was gender and diversity audit, and this looks into the issue to an extent. We also need to do more community-focused studies on the issues as well. But with the gender and diversity audit, what we did was assess our strategies, policies, and programs through gender and diversity inclusive lens, examining what we have done right, what should be improved, and we are working on those. And we did this with the participation of UJG staff, students, and faculty to examine our organizational culture, policies, programs, and strategies. And we anticipate the reflection or this kind of studies to be done in other academic institutions, civil society organizations, and so on. And we are available to provide support if anyone is interested to have a similar gender and diversity audit. And another important thing we are already doing is a mentorship program. There is a need to do more of that in the future. We are connecting women with senior women who have succeeded in the field of global health. And this program was not significantly affected by COVID because the interactions were taking place online. But of course, nothing compares to face-to-face interactions, right? And I cannot say that we did not miss anything completely by these virtual engagements, but more needs to be done. So overall, understanding the gaps and addressing it in different ways should be a continuous process. We need to do a lot more in this objective for equity. We want to see more women leaders in STEM research, scientific councils, as mentioned earlier, academic roles, institutional leadership, and whatever we are doing at the Center for Gender Equity, be it an staff hire, student recruitment, training, and research is aimed at improving that. Thank you, Professor.
Thank you, Sion. Very interesting. And the gender and diversity audit can be a great tool for institutional audit that include the community we interact with, but also, as UJG is based in rural area, the community where we live and to make sure that we do our best and everything, and to innovate new approach for promoting gender equity in all areas, including science. My next question goes to you, Professor Flavia. How do we ensure that the policy which are there to support women and girls in science are implemented? Because, you know, year after year, and since long time, there is policies, etc., that policy strategies that are proposed at the highest level. But the most important is, how do we ensure that they are implemented? This is a question for you, Flavia.
Thanks, Prof. Binagwaho. And it's, as I said in my presentation, it's such an honor for me to be here, and my condolences to the UGHE family. We mourn with you at this difficult time. I mean, I couldn't agree more with you, Prof. Binagwaho. I mean, we have the UN Sustainable Development Goals, we have the African Agenda 2063. So there isn't a lack of commitment, that's for sure. But, you know, you have a sense that in terms of implementation, it's something that's been dragging on and on. Even just if you look at institutionally, people will tell you, we've got these policies, we've got this intent, and you will ask, how long have you drafted this policy 5 years ago or 10 years ago? I think we have to start, it's actually a layered approach. If we look at institutionally, these implementation have got to be linked to the key performance areas of the managers. So you will say, as an institution, we've got this policy to ensure gender equity, and so put it in the dean, the deputy deans, the vice chancellors' key performance areas when we are evaluating them at the end about how well you have done as a university or as an institution or as a department. The second layer is, in our country, we have to look at a line item that is there on our budget, because, you know, policy is not just having this particular policy. The policy has to be costed, and there are costs which are involved. In each and every single one of our departmental, whether it is higher education or ministries of health, we've got to have this line item of gender equity that is budgeted and that is there, that will allow the minister to implement this policy. Otherwise, without that budget item, it becomes a problem. And borrowing on what my recommendation in terms of the institution, when our minister or HOD gets to be evaluated on their performance by the president, how wonderful would it be to say, this key performance area of this policy that's been lagging behind, how far are you? And if you haven't implemented it, then you are not, you're not doing your job. And so it's about accountability and ensuring that it's not just about us advocating all the time, but having these tangible spaces where we hold people accountable. And that's what I would say, Prof. Binagwaho, that unless we have it tangibly written in key performance areas as indicators, and it is assessed, whatever, depending on the country, whether it's annually or in a quarterly review, it's never ever going to happen.
Thank you, Flavia. And you point out accountability. Yes. Stop talking, act and walk the talk. Yes. And to do that, to agree on monitoring and evaluation of implementation and commitment. Yes. And you also suggest something that is great, gender budgeting. And I have to tell you, as my personal experience, that when in Rwanda, gender budgeting was introduced, it really make you think differently about the money you allocate. And it make you think differently about each boxes of your budget, saying what they can do more for women. So you are right, because the bias are conscious and unconscious. And those tools can help for the bias, at least, that are unconscious, and to make accountable everybody to the bias that are conscious. So great, thank you very much. Renzo, I have a question that is here for you, because it's about Asia. Do you think higher education institutions in Asia played a role in the decline of academic productivity among women during COVID-19?
Wow, thank you very much, Professor Agnes, for that question. Not an easy one for sure. And before I proceed to my answer, like Professor Flavia, I just want to express my sympathies to the family of the University of Global Health Equity. You know, Paul Farmer is the feminist global health leader par excellence. And, you know, I've met him several times during my stay at Harvard, and I'm just so amazed at how he, through his work, through his example, he actually uplifted or helped advance the global health careers of many women in our field. And so I think that just needs to be said in this event. And this event is truly made in his honor. You know, the question, what's the role of academia in you know, this decline of productivity? I mean, I think during COVID-19, there's actually a lot of productivity overall that we've seen in terms of academic publishing. I think a lot of the younger generation of scholars are witnessing, monitoring, observing the pandemic, writing about it, sharing their ideas about it, and again, you know, trying to contribute to the discourse because of the dissatisfaction that we are facing, that we're experiencing towards, you know, perhaps the failure of the response in some aspects. And so overall, I think the productivity is certainly much higher than before the pandemic, especially, for example, in the social sciences, and of course, undoubtedly in the medical sciences, because that's where the need is. But, you know, if the question is how about, you know, the gender difference between, you know, males and female researchers in terms of productivity, you know, I think, you know, female researchers were really at a disadvantage during this pandemic. And I think I mentioned that already a while ago, you know, the multiple responsibilities that were imposed on them. You know, it's not that they selected it or they chose to assume those roles. These are all actually socially prescribed. And unfortunately, we as a society, you know, just basically continued business as usual, even if we've been talking about the new normal of this pandemic. And so I think that's a major challenge. And now that we are seeing the pandemic, well, slowly stabilizing, although we can't be complacent because we don't know if a new variant will emerge, especially that universal vaccine coverage is still not available for all of us, especially in the global South. You know, I think the challenge is how to, you know, bring in more, you know, voices and contributions of female scientists and researchers, not just in Asia, but in different parts of the world, while at the same time, we are able to, you know, provide, you know, support and the enabling environment so that those other, for example, roles and responsibilities that need to be addressed are also addressed, you know, are not forgotten. And it's a challenge, right? And I think, you know, we young men, you know, male scientists do have an important role to play, you know, one in terms of sharing the responsibilities. You know, we can't just be focusing on our work and forgetting about our role in the household, for instance. There should be sharing of responsibilities. I agree with the earlier remarks about really investing in opportunities. But the thing is, we can put in a lot of money to gender empowering activities. But if we truly do not address the systematic roots, you know, the behavioral aspects, the biases and the stereotypes, you know, the attitudes of male scientists like me towards colleagues, then nothing will change. Or, you know, it will be a very minimal change that we will see. You know, a while ago, I referred to this tick box exercise. The change will remain as cosmetic. You know, we have more female faces in decision-making boards that, but fundamentally, research productivity is still very much skewed towards men. So I guess those are some of my initial thoughts, and I look forward to hearing more from my colleagues as well. Thanks, Professor Agnes.
Thank you, Lorenzo. And you are right. the role of men scientists is very important at work and at home, and also in the society to break the systemic barrier. But we should also see how to bring scientists to be more influential in their community to change the culture in general. That's a great avenue that you have given there. Marlene, the next question is for you. How can the global community and national government increase equity to good quality education?
Thank you, Prof. Agnes, and I want to echo the feeling of my colleagues in the panel today about our great colleague Paul Farmer. I met him only twice, but it's more than enough to be impressed and to follow also his work and his legacy. Now, what can the global community do? I think a lot. Think globally and act locally. And maybe before I go there, I want to share some personal experience that is relevant for the discussion now, because gender is absolutely key, but not only gender. There is gender inequity in education and in universities, but also social inequity. So I think we should look at not isolating. Of course, today is International Women's Day, and we are fighting feminist dialogue and spirit. We are fighting for girls and women. But we should also look at the social inequities that are very often going together. And going back to my own region, to Europe, when I was a young girl and I wanted to study, to go to university, my parents said, no, university, that is not for girls of all social class. That is for the boys and for the higher levels. So it was kind of just a note, the doors were closed. And I really had to fight as a girl, that's 50 years ago, of course, but to be allowed to go to university, because the social layer of our community did not really allow that. And of course, a lot has changed in gender and in access to education, but still, so many years later, when then I became an academic and I did my PhD and I made a career at university, still we see that there is a huge imbalance when you go to the higher levels. You have more and more girls in medicine, even more than boys. They do very well. They specialize, great, not only in Europe, but everywhere in the world. But then when it becomes to the level higher than assistant professor, you see actually that the gap is increasing. We have discussed this already in global, in local, global spaces. What can we do? And I think your leadership is providing one of the answers with gender and social budgeting and so on. But 20 years ago, we were thinking already, when do women lose their advantage in academic perspective because they are doing better than boys? But then suddenly, just because at that age they have children, they have their families, they have more responsibilities. And I love Lorenzo's comments. I hope that there are more men, and it's not only the talk, but also the walk, who are helping in taking their share also in the family tasks. We had great ideas that are not realistic. One of them I want to share. For example, what if for every child or every pregnancy you gave like 2 papers in the Lancet equivalent? It was kind of a joke, but saying what we need to compensate, we need to bring that in, that if you make promotion and you have a man and a woman of around 40 and they apply, what do we look at universities? We look at their age index, the number of publications, the number of days, the number of days. But on the average, young women who have then also, not all of them, but most of them, their families, they lose a couple of years or points or whatever. So I think we should, in the global and in different global communities now, there is a thinking, what kind of mechanisms can we develop that are truly giving equal chances to also climb the ladder to associate professor, and taking a leadership role in the academia. I have more to say, but I will wait for the next round. Thanks, Agnes.
Thank you, Marlene. Thinking about a global reflection on what mechanism could we put for equal chance for women. Yeah, it's important, because if we have children, it is for the society. But to do that, we are penalized because we cannot be as present for our career, because we dedicate time to our pregnancy, our delivery, our breastfeeding period, and also to the domestic time we spend to cherish our children. So that's something that is discussed since long time, Marlene. And for my point of view, we should consider every pregnancy of a scientist who is a woman has a mentorship period for a future Nobel Prize, and take that as an achievement. I think this will change the dawn. But if we don't find something that is quite revolutionary, we will not make it. But it's a good way. What mechanism can we find that give equal chance to women in scientific career? Dear Flavia, I'm coming back to you with another question. We have so many challenges, but in some science space, we have women who are first and are leading science and science organization. What do you think is the role of these first women in improving the current situation of women and girls in science?
And what an important question, Prof. Binagwaho, and it fits in so nicely with what Prof. Marlene was saying, you know, having the bottom down and then you have this tapering up, and you always will have these women who are first. My first point of, which I always say in every single panel, and it's always met with surprise, but it's a reality. Women have always led, you know, and it seems very strange. We've always been leaders. Even if you look at our continent in Africa, women had a position and we had a role. And so our role was not only just being a caregiver. Even if you look at your traditional medical practitioners in Africa, there were always women. Women leaders, I don't want to name, you know, go on, but we had women queens, we had battalions of, you know, armies that were led by women in Africa. So this thing of thinking that it is strange is a modern thing, you know, that women cannot lead. This is the first thing that I do want to say. And so in essence, I couldn't agree more with what Prof. Renzo was saying about a cultural change. And maybe I want to prefix it with saying it's a modern cultural change, because culturally women do have a space and are recognized as leaders. And so this notion of firstables, as I call them, is a very modern thing. And my sense is, first of all, is women, when they find themselves and they are the first, and I think most of the women on this panel and probably in the audience have found themselves in spaces where the first ones to lead whatever organization. It's worse so if you were a woman of color, you really are usually the first woman of color leading 100-year-old or 200-year-old organization. And I believe, first of all, your role is to, and I'm going to put it simply, Prof. Binagwaho, sit on that chair because you belong there. That's the first thing that I have to say. Because sometimes you sit there with this apologeticness of maybe I don't belong here, maybe somebody gave their space up for me, maybe you belong there. As Prof. Marlene was saying, women usually work 2 to 3 times harder. Number one, you belong there, you've worked hard, yes, sit on that chair. What's your responsibility? Your responsibility is to break down those structures if they need to be broken down. because usually when you sit there as a woman, those structures are not geared to welcome you. And they are usually extremely toxic. You really have to get on with it. And, you know, it's always just so difficult. And it's to ensure safe spaces so that the next women also come up. And it's to ensure the mentorship. One of the audience members asked about mentorship. It is imperative that first women have to mentor other women. I dare say as well, and Prof. Renzo would like this, maybe even mentor other men and bring in men like Prof. Renzo to say women do have a place. They've always had a place, and there is that time, you know, a need to change. So for me, it's about, I cannot speak anything else about, you know, the structure. It's always just such a difficult space to be the first woman, the change of structure, creating those safe places. Once you've created them, of course, how do you create them? I always go back, because my space is policy. You have to create those policies, because you know what? When you leave it as a first woman, you usually will be replaced by a man. And so you have to create those gender-friendly policies to ensure that there is a pipeline that is going on. I mean, the organization that I lead, I always make a joke, and I say every 20 years, you know, the men say, okay, now we need a woman, you know, so I'm the third woman in 65 years, and I'm the first woman of color. So my role has been during my triennium to ensure that we put policies in place so that when the next man comes in, at least those policies are there and they are implementable. And I couldn't agree more to ensure that there is that cultural shift and change. Thanks.
Thank you, Flavia. And congratulations to be the first woman and woman of color, because that's true that in many, many scientific fora, or even in politics and administration, it is a double challenge to be a woman and a woman of color. And we can see the women are often seen as less competent than any man with the same diploma. You see what happened now with the Supreme Court in the US. They asked this lady to show the diploma. They never asked that to any man. And just because she is Black. She will not be the first woman, but she will be the first person with those two challenges, be a woman and be a woman of color. So yes, and there is also something else that we can see in the reaction of women in general, the doubt of, they don't, when you say you sit on that chair, you belong there, women as always doubt that they can do, and they don't know because they have been educated to doubt. And men, even when they don't really know how to do, they will say, oh, of course I can do that, it's simple. So that means in education, starting when we give the first drop of milk to our kids, we should educate them to overcome that personal bias that invade all your brain as you grow. Yeah. Dear Renzo, I have another question for you. How should we make our academic structure and curricula resilient enough to withstand future uncertain disruption like COVID-19 that has increased the gender disparities in academia and education? Access to education, but also academia. To you, Renzo.
Yes, and I don't think I am allowed to start my video, so if the technical team can help me. But to answer your question, Professor Agnes, and actually, I just want to respond first to the example that Professor Flavia gave about, women, unfortunately, always had to face the burden to be the first, in their institutions. Funnily, in my case, it's the other way around. when I returned to the Philippines, I established the first planetary and global health program of the Philippines. And it's my women bosses that gave me that opportunity. So I'm actually part of a women-led medical school, the dean, all the associate deans, and they were the ones who actually believe in this young man, and in his vision to start the first global health program of the country. So now I think we're seeing that the tables have turned, right? And that's, even perhaps a small example of progress, but certainly that's not yet the situation worldwide, and we need to do better. To answer your question about curriculum and academic institutions, making them resilient and making sure that every young woman and man do actually have equal opportunities, even in the face of disruption. And I just cited the example of our medical school, which has demonstrated enormous resilience during this pandemic. We happen to be the first medical school in the Philippines that invested in digital education prior to the pandemic. So, my women, dean and leaders in the school, they were actually, reflecting, wow, we actually anticipated this pandemic because we've put in place the necessary structures that will allow us to continuously function even in the face of a global health crisis. Of course, digitalization, while it may have created or enhanced our ability to respond and to continue our work, even if there are mobility restrictions, having a smartphone or a laptop and a Wi-Fi at home is not a guarantee that gender equity in your institution will continue and will be sustained. Because remember, a while ago, we were discussing about the multiple roles and the cumulative workload, cumulatively growing workload faced especially by women now that work and homework are happening in the same place. So no digital technology can actually fully solve that. So we need to make sure that we're not thinking of digitalization as a panacea to all of these problems. And so I think what we've been doing is we're making sure that, curriculum is adjusted to make sure that, the mental health of students and faculty are being safeguarded, because it's not, Zoom made it easy for us to have conversations and to continue our education, but it can also be very stressful. I'm sure everybody's experiencing Zoom fatigue 2 years after the pandemic has begun. And so we have to make those kinds of adjustments. And so, I think that's just one example. And of course, providing different kinds of support. And usually the support that we need to provide to the members of our community, our constituents, are more social and psychosocial in nature rather than material. And that's, valuable, especially in this day and age where people are facing multiple stresses as a result of this crisis that we're facing. I'll stop there for now.
Thank you, Renzo. And it's a very good summary. There is Rosalind in the chat who has a question for you, Sion. Could you explain to our audience the mentorship of the younger generation that it's done through the Center of Gender Equity and Diversity?
Thank you, Prof. Yeah, we have a mentorship program that runs for 2 years for each cohort. And last year we had 20 mentors and 20 mentees. That is still running for the first cohort. This year we have 24 mentors and mentees. And this will be a continuing program. We actually plan to expand it as resources permit, but it is very important for young, early to mid-career professionals to get this kind of support from mentors. We also have academic level mentorship at UGHE for all students, be it the Bachelor of Medicine, Bachelor of Surgery, or the Masters in Global Health Delivery Program students. So we have we have that in our plans, and more information is also available on the website. So please check that out as well.
Absolutely. And also this mentorship is, the majority of the mentees are girls, but we have also young boys in the field of global health and research as well that are part of the program. So don't hesitate to apply if you are interested. Marlene, I have a question here for you. As UNESCO chair to promote young leaders in health science, education, and gender in Kenya, what is your approach to leverage opportunities for young people, especially young girls?
Thank you, Agnes. So yes, we, for your information, universities can apply to UNESCO to get a UNESCO chair in an area that they want to develop. So we in Kenya a couple of years ago decided to apply for this UNESCO chair in investing in the next generation of young leaders, with, of course, equity and gender as one of the leitmotifs, but not only, because now more and more young men, they are saying, you know, we won't have access to this scholarship because it's always for the young girls. And of course, we should also keep a balance there. So what we are doing, we are trying, number one, to have a mentor-mentee project like you are having, and to have young academics interested in research, to give them the opportunity to have a one-to-one mentor working with them as mentees. I think it's quite similar to what you are doing in an area of public health, reproductive health, and now more and more, of course, also the environment and the climate changes. So we work in our kind of zone of comfort that we know best, and we are trying to help them for their master's and their PhD program. So that is something that is a quite young, new initiative. The UNESCO checks don't get funding for that, but it allows them to contact and work together with donors and partners who are willing to support this kind of initiative. So maybe we could do something, we could work together in that area. There is one other point that I want to bring up, a bit related to COVID, and it has been mentioned maybe already earlier this afternoon, but again, an example from Kenya. In 2010, Kenya has changed its constitution, a new constitution that made it mandatory for all children to go to school, boys and girls, which was not the case before. Of course, that's only 12 years ago and it needs time, but we have now a generation of young girls who go to school. We see more of them going to secondary and higher education. But now with COVID, the number of schoolgirls who got pregnant over the last 2 years and who are really losing, in theory, they can go back to school. In practice, we see that it's very difficult for them. So we need to, I don't know how much it is in Rwanda, but in Kenya, on the average, we have 20 to 25% of the schoolgirls that are pregnant. So this is an enormous waste of opportunities. And we should do our very best, not only due to COVID, of course, but to really work with the schools to prevent these pregnancies, with the schools, the families, but even when the girls get pregnant, to encourage them not to stop at that stage, but to try to reach their full potential. And we need programs for this because this is really a huge problem, and not only in Kenya. Thank you.
Thank you, Marlene. Yeah, it's a huge problem globally because many studies have been done in all type of setting, high-income countries, low-income countries, middle-income countries, and everywhere pregnancy is an extra challenge women are facing for unwanted pregnancy, and meaning pregnancy out of the cultural norms of marriage, are an obstacle for even a socioeconomic development of girls and women. So this is a huge problem, and I agree. I wonder if there are some specific activities. Renzo, I will call on you for this. Do you know best practice that has supported girls to overcome this challenge of unwanted pregnancy out of cultural norms, meaning out of marriage?
Yeah, and I think the video is not opening yet. Well, you know, admittedly,
I agree with you, Renzo. It's not fair. You are the only male in this panel, and the video is sabotaging you. There's a problem.
Right. I'm now made invisible, and now I'll become visible again. You know, well, Professor, and yes, admittedly, that's not an area that I'm very familiar with. But in terms of unwanted pregnancies and teenage pregnancy, perhaps it's certainly a related issue. That's now a growing problem here in the Philippines. That problem has actually you know, grown, especially during the pandemic. So that's one of the, I guess, the side effects of all the lockdowns and the mobility restrictions and reduction in, you know, social activity outside. We've seen this phenomenon, this you know, problem or challenge. You know, it has grown over the past 2 years. And I think the solution is really to make sure that, you know, young women are, one, receiving the right education in school, but also not just young women, but also young men and all men, right? Again, I think it's, you know, we need to make sure that men like me, like myself, do acknowledge their responsibility when it comes to this issue, and that they are seen as part of the solution, right? We cannot solve this problem of you know, unwanted pregnancies and teenage pregnancies if we do not really engage the men as well. I think I'm seeing some promise, for example, when it comes to, you know, social media engagement. The Philippines is the social media capital of the world. There are more phones and Facebook accounts here than people. And what I'm seeing is that young people, both men and women, are becoming more comfortable in having discussions about these issues related to gender relations, related to, you know, sexual health, related to HIV/AIDS. The Philippines is one of the very few countries in the world with rising HIV/AIDS incidents. So that's a problem in the country and a continuing problem. But then we're now seeing that there's a lot of information and education and information dissemination, awareness raising happening in the digital space. And I think that's something that we can also take advantage. Of course, we need to also acknowledge that there are some places where there's no internet connectivity, and we need to rely on our more traditional approaches to education, awareness raising, and, you know, community engagement. I'll stop there for now.
Thank you, Renzo. Promising the use of social media to change culture in that field, yes, should be developed. Sion, there is a question for you about the study that you have presented in your introduction. What are the preliminary findings of the study on barrier to female access to the field of medicine?
Thank you, Prof. Agnes. So the study is still ongoing, and right now we are cleaning and organizing data. But based on what we have collected so far, although it's not focused on the situation during COVID-19 pandemic, it was possible for us to see how community perceptions about what girls can do and cannot do, perceptions about what women like to do and do not like to do, and then females' confidence in pursuing science streams, in addition to household inequalities in access to resources and decision-making power, are contributing factors for limited engagement of females in STEM fields. Again, in the case of in the field of medicine. So I'm sure when resources were scarce during the COVID pandemics, I'm sure their access to such programs was more constrained. But we need more information on dropout rates, teenage pregnancy that was mentioned earlier, and how this impacted females' participation in STEM. And again, I would like to say that right now at University of Global Health Equity, there are other studies focusing on teenage pregnancy in the context of Rwanda that are being undertaken by faculty. And our students are also now designing practicum research projects on different sexual and reproductive health elements, health management issues at the community level. And these are done in different settings, including refugee camps. And this may give us a better picture about the impact of COVID on females' well-being in general and their engagement in different programs. So knowledge production is a key in this process, and students and staff are contributing to this. Yes, this is indeed very important, and thank you.
Yes, thank you. And also, COVID-19 is it was an exceptional time, but the outcome of this research will help us to have ideas how to proceed during ordinary time. Even though I don't know if we will not face challenges after challenges, threats in health sector and education sector, one after the other, because the climate change is not promising at all, for at least for our continent and for the world in general. Flavia, there is a question here for you that it's not linked to education exactly, but it's based on your experience as a public health specialist. What were the most pressing challenges faced by female healthcare practitioners that we should address in preparation of coming health threats, such as pandemic?
Firstly, I want to say that it's recognizing the contribution of women. Usually the contribution of women is very much invisibilized or attributed to men. And so in essence, that's one of the biggest challenges. So if a woman resuscitates a patient or goes out and develops this wonderful program in the community that will alleviate whatever it is, like communicable diseases or non-communicable diseases, it's usually invisibilized or it's usually minimized. Oh, that old little program that they developed, but you can literally see the change that is happening. Or, so I think first of all is to recognize that the contribution of women matters. And the contribution of women is valid. It's such a big thing because it goes back to what we were talking about, Prof. Binagwaho, in terms of the first women, what is their role? Even women who are excellent, as Professor Marlene was saying, women have got their associate professors, and usually they have doubled, the requisite whatever it is, indicators for you to be a professor or full professor or associate professor. And so it's important for us, one, to recognize the contribution of women. That's number one. The second bit of it is really to support women. Once they have achieved whatever magnitude it is, support them by recognizing, again, it goes about make their work visible, publish it. We haven't even talked about, the inequity in terms of publications, the inequity in terms of access to funding when it comes, it's just such a broad topic. But for me, it's really to ensure that whatever work that women do, we shine a torch on it and not only stop there, but ensure that we actually expand on this work and we recognize it and we attribute it to women. If you look at the history of the contribution of women in science for such a long time, if you're working with your husband, it's usually attributed to your husband. And so some of these things I think are still prevalent in our society. And so for me, it's about ensuring that when women do contribute, we have webinars like this where we will really show their faces and hear them speaking about their science.
So you are right, and it's not only in science, it's also in other fields. Write a book with your husband, it's going to be attributed to him. We know many authors who have faced that long time ago, but it's also continuing. So we reach slowly the end of our webinar. Renzo, we really appreciate your contribution. As a man feminist, you really are doing a lot to sensitize other men to follow the same path. And it's great to see that your path has been facilitated by women. And we know that when women are in leadership position, they are more fair, more inclusive, and also more focused on promoting the best in all of us. Of course, we cannot say it's 100%, but statistics are there. Flavia, thank you for giving us your experience. And there is a lot ongoing in your society where there are double challenges that you are the symbol that they can be overcome, being a woman and woman of color. Also the fact that we know that when we have a disadvantaged group, bringing that group at equal situation, then the others need positive, what we call positive discrimination. And we count on women in leadership position to have that in mind, to give and detect all the potential of the young women that are around them. And also give the example to the young men scientists and turn them in activists and feminists. Marlene, thank you for your perspective, your global experience in many areas, in politics, in academia, in research, have really give this webinar a great dimension. Sion, thank you for hosting us. So thank you all our panelists and attendees for participating in this webinar and for taking this opportunity to use this platform to raise awareness of the different challenges faced by women and girls in science that were exacerbated during COVID. And we know that every time there is a threat, women are paying the major price, and gender equity tend to roll back. But also, we appreciate the possible solution that you have all provided, and we will try to put all this together to make a report and give something to the audience and to the global health family so that it helps to build a stronger and equal scientific community. We have all learned and we have all understand that more need to be done, but we can learning and continue our journey to gender equity in science. But we need to make more effort than ever because the challenges will be there. On behalf of all the global health family, I thank you for your support and kind word for the loss of our friend and co-founder of the University of Global Health Equity, Paul Farmer, because he was the leader of the entire global health family. So, and thank you, Tion, our host and chair of the Center of Gender Equity. If you want to know more about that center, please go to our website. The webinar is recorded and will be disseminated in all UJG channels. All your questions that are not answered and that are on the Q&A or has been sent in other channel will be responded with using the hashtag Ask Professor Agnes on Twitter, Instagram, and Facebook. So thank you for today's session. I wish you all a nice time, whatever place you are participating from. And I look forward to seeing you again in the next month's Ask Professor Agnes Equity webinar. Stay safe and equity first. Bye.
Thank you.
Bye, everyone. Thank you.
Bye-bye.